So when cannabis was made legalized on prescription, cannabis medicines, that group of patients were probably the first people to reach out to it because they were familiar with this idea of self-referral. They were directly approaching the providers of the prescriptions themselves, so the private clinics. And for some, because right at the beginning, it was rare to have nurses in those clinics. So whilst the influx of patients, the admin staff sort of process them, they see the doctor, they get their prescription, then the clinics didn't have at that point an infrastructure to retain those patients. They had a flood of patients and then were unable to provide this ongoing care that actually complex patients like that actually need, especially when you're trying to figure out a new set of medications.
Nurturing what's natural. With medical cannabis steadily gaining ground in Europe, it's key that patient care is always the key pillar in its growth. We sat down with the founders of Nurture Nursing, Elly Owen-Jones and Sophie Hayes, to find out why nurses play such a vital role in this process and how their expertise is being put to work in the UK, educating patients and medical professionals alike.
Hello and welcome to the Lobsterpot podcast. I'm Dave Barton, the co-founder of Thermidor. I'm high in the clouds today, as per usual. Jamie, where are you today?
A lot more grounded by, judging by the backgrounds. I'm quite jealous of that, actually, Dave. I do want to be a part of it. It's got the right level of sort of colour and flavour, and it suits.
I think we're on brand, aren't we? Even though it's not technically green, but I'm trying to find a nice segue into introducing our guests. There isn't one that's cloud associated, other than the clouds of kind of medical cannabis that they so promote as such. We have Eleanor Owen-Jones and Sophie Hayes from Nurture Nursing. Welcome to the show. How are you both?
Thank you. Thank you for having us. Yeah, we're good.
Yeah, excellent. So it's rare that we have guests from the UK, but it's quite welcome because, again, as you know, the whole situation around, cannabis, legalization, medical cannabis is so kind of fragmented here. But yeah, tell us a little bit about what yourselves are doing and about Nurture Nursing and the sort of role you play in helping, promote the cause of medical cannabis. I know that it's quite both have different approaches. So maybe Sophie, do you want to kind of give us a little bit of background on yourself and what you're doing? We'll go from there.
Yeah, sure. So sort of my journey into this space was sort of a combination of my both like professional practice and like sort of personal experience. So in 2010, my partner got diagnosed with Crohn's disease and was using cannabis self-sourced at the time and found it very helpful for managing his symptoms. And that were things like pain, sleep, low mood, appetite stimulation, anxiety management. And from that, I think, because of the kind of people we are, I was a practicing nurse at the time. So it was, we were just not satisfied just to accept that as is. We were curious as to why that might be happening and whether it was legitimately something. And we also wanted to understand whether it was harming him or not. So we did some reading. We met some other people online that were other patients with a variety of different conditions. And then my partner and those patients set up an organisation in 2014 called the United Patients Alliance, and that was a patient organisation advocating for cannabis on legal prescription in the UK. In 2018, they succeeded, and along with huge array of different groups with slightly different focuses, be children or adults, and so at that point I was working in A&E and then I was working in intensive care after that as a registered nurse in London. And post-pandemic, I suppose before the pandemic, I was asked to speak at a launch event for a nurses organisation called CPAS, which was aimed at educating nurses who were either coming across patients who were using cannabis in what they reported to be a therapeutic way, or were coming across patients who I think there was just how they managed those patients was really key. And our big focus was to make sure that those nurses had their PINs protected, but also interacted with those patients on evidence-based practice, which was one of the 6 C's, the codes of conduct the NMC sort of requires nurses to work under. And that we launched at the Royal College of Nursing in 2019. obviously 2020 pandemic happened and ITU was hella busy, might be an understatement. Towards the end of 2020, I left frontline practice. It felt a little bit like going into battle every day, and I couldn't do it. So I got asked by someone was trying to set up a clinic that was prescribing cannabis medicines. And I think because of the law change, because of my professional practice, because of my experience with not only my partner in sort of the personal everyday experience of trying to manage that experience, but also in advocating for the law change, I got asked if I wanted to be the lead cannabis nurse at that clinic. I accepted. We set a clinic up called Integro Clinics. And then a year on from there, we did a conference in the Royal Society of Medicine educating clinicians and consultants in cannabis medicines applied in practice, which was fantastic to be able to do that at the Royal Society of Medicine. And from there, I think because the conclusion of that, and I think every article that's ever been written or conversation about cannabis medicine, particularly in the UK, has always ended with what there needs to be more research needed, more research is needed, more evidence is needed. And I got offered a job as a clinical trial manager for a company called LVL Health, who run clinical trials in cannabis. So it just felt like a natural progression of where to go. And I'd known Elly for maybe like four years at that point. And Elly came to me and asked if this was something that I would want to do, is to actually set up a business where nurses could both be recruited into cannabis medicine, because we felt that cannabis medicine as a field was lacking this core bridge profession between the patient asking for cannabis medicines and the doctors prescribing it, and that actually the patient care and the patient interaction predominantly is always nurses, regardless of the service that you are looking at. So it was about trying to encourage more nurses to be involved, but also to actually give advice to businesses that were looking to set up in the UK or abroad, who had just got really excited about cannabis medicine as an area of investment. But we noticed that because the people who were enthusiastic about it and investing the money were actually from either financial backgrounds or from sort of legal or marketing, but they were very enthusiastic about it, that actually having real life clinical practice to advisors will ensure that patients are kept at the center of all these businesses. And that's really key, especially when we're looking at essentially at this stage still a novel medication group, and trying to integrate that into normal practice. So that is, I think, I don't know how long that was, but that's how I got from where I was to where I am.
Absolutely. Here. No, it's I mean, it's fascinating. There's so much there. How about yourself, Elly? What's your kind of story?
So my background's slightly different from Sophie's, but in terms of the medical cannabis, I'm based up in Manchester, and I started doing the GW pharmaceutical studies in Sativex at the Christie Hospital and end-of-life cancer patients about 10, 12 years ago. And that was how my journey into medical cannabis started. Did that for a few years and then went off into the pharmaceutical world. I got employed then by Canopy, a cannabis company from Canada, to start up the medical team in the UK. It was a whole brand new team. It was kind of go out there and see what the world is about, really, and did that for a couple of years, built up a fantastic network. And sadly, the medical team in majority of Europe for Canopy got made redundant. So I really was still passionate about the medical cannabis side. But as Sophie says, within nursing, we're always going to be massive advocates for nurses. We are nurses, and it's very much behind, as Sophie's already said, behind any specialist team is a massive group of specialist nurses leading the way. And the one thing, especially working with Canopy, that I found, and Sophie's already alluded to as well, is that international people mainly don't understand how much autonomy a nurse within the UK has compared to a lot of other countries. And they don't understand how a nurse can pretty much lead it, but, take care of the patients. They just can't write the prescriptions at the moment. So we had a good chat. We've got a nurse-led company over in the USA called Elly 411, who we deal with a lot as well. And it's very much, she calls us her cannabis sisters, and we're there just supporting each other. And it's understanding the key thing is nurses can help lead medical cannabis, but it's how do we support that? Yes, we work in two different healthcare systems between the USA and the UK, but ultimately it's how do we educate the nurses, how do we support businesses with the nurses, and then also from my side, having a long clinical research background, it's how do we help companies, individuals, nurses, doctors, whoever, in their clinical research ideas, in everything from submissions to MHRA, protocol writing, to how can you run it out in practice and the logistics of it.
Wow, I mean, there's so much wrapped up in that. It's again, just trying to think where to start with the sort of questions. I mean, you mentioned about the role that nurses play in the UK versus perhaps other countries. Do you feel like you have a more autonomy here in the UK?
Yeah, definitely. Definitely. I know that I've got a background of cardiac nursing, and I know that in a lot of European countries, you are just a cardiac, not just, but you are a cardiac nurse. They don't split it into specialisms. So when I spoke to people in the European country before, they didn't understand how you can be so specialist and how you can run your own clinics. And a lot of countries also don't have prescribing nurses. So we have a hell of a lot of autonomy compared to a lot of other countries, which a lot of people don't realise.
No, I mean, I certainly didn't. I think, again, the perception, wrongly so, is perhaps that, there's a more supportive role that nurses will play in the healthcare system. But, it simply doesn't seem to be the case. And I think that's one of the biggest perceptions. And I guess in terms of being advocates for medical cannabis, you have a very important role to play here. Which is really interesting. So, I mean, how are things sort of changing from, on the front line from the clinic perspective? I think before we were thinking there was something like 20,000 patients in the UK, but now isn't it closer to it's close to 100,000, isn't it, Jamie? Something like that, recent stats or something?
Some data came out the other day. I think it was like just shy of 90,000 private prescriptions, and it's whatever is like 12,000 NHS. And then unlicensed products are less than 5, something like that. I'll have to look it up, but yeah, it's around that much.
I read that article this morning. Was that the Business Can?
Yeah, I think it's about 100,000 patients total UK.
Yeah.
So adoption obviously isn't very good in terms of, well, perhaps by comparison with more established markets like in North America. Do you think, well, obviously it's changing, but why do you think it's changing? And do you think that, I suppose, clinics have a part to play in that, in the way that they kind of advertise their services and in the level of care that they provide? You mentioned like the idea of nurses being, well, critical to kind of patient care and keeping the patient first in the whole journey. There's a lot of kind of money flowing around and people wanting to invest and getting excited about the opportunity, but it's almost like you guys kind of keep the whole thing grounded and to the point that it should be around. What do you think some of the work that either yourselves or other people that colleagues are doing to help grow medical cannabis in the UK?
Because I feel like you asked a lot of questions in one line of thought.
Just pick one, it's fine.
It was great. No, I think that, so there are two groups of patients that approach cannabis medicine. There are patients who would be considered expert patients, so patients who have been what you might call self-medicating with cannabis for sometimes decades. They've been doing this independently, sometimes with the knowledge of their clinicians, sometimes not with the knowledge of the clinicians. One of the things I realized in advocacy was that the number of patients who had serious, like, long-term conditions that often were at risk of deterioration, who through disclosing their cannabis use to clinicians had a negative experience with that, everywhere from being told that they just didn't want to hear about it, just if I don't know about it, then you can carry on, to I'm going to call the police or the social workers. You know, it's that serious. I'm not going to provide care for you. And they had withdrawn from the medical system altogether, and that they were seriously unwell people who were managing through their own use of cannabis. And if they were fortunate enough to have met other communities of patients who were doing the same thing, they were trying to figure that out themselves, but they weren't attending for regular MRIs or long-term strategies like physio. So that was the most concerning thing for me. So when cannabis was made legalized on prescription, cannabis medicines, that group of patients were probably the first people to reach out to it, because they were familiar with this idea of self-referral. They were directly approaching the providers of the prescriptions themselves, so the private clinics. And for some, because right at the beginning, it was rare to have nurses in those clinics. So whilst the influx of patients, the admin staff sort of process them, they see the doctor, they get their prescription, then the clinics didn't have at that point an infrastructure to retain those patients. They had a flood of patients and then were unable to provide this ongoing care that actually complex patients like that actually need, especially when you're trying to figure out a new set of medications for them. So some people who were experts came and then left because they had a bad experience. Other patients who had never come across cannabis before and had been told by a friend or a family member that this was something was now available to them, they approached the clinics. And again, this was a similar experience where if you've never engaged with cannabis before and then you don't have a nurse in that clinic, you know, checking in on you, or that, you know, telling you, you know, this is the first time you've ever used this. If you need anything, you call me between these hours. You know, this is just reassurance for them. And again, that wasn't necessarily there. So our patients came and then left. So nurses are integral to cannabis medicine because they provide the care for complex patients, because these patient groups, by the time they reach cannabis, because the requirement for a prescription is that you've had to have tried at least 2 medications for your condition, the majority of patients have gone through decades of different specialities, different teams, different hospitals, different doctors, and by the time they reach a cannabis clinic at this point, they have exhausted a lot of options, and they are very complex patients with lots of different conditions to manage at once. So actually, without a nurse to manage that is a very difficult system to maintain and actually have people feel cared for. So nurses are essential for that reason. It's also to provide support to the doctors, because again, expert patients who approach doctors in the clinics would often come saying, you know, I want this strain, I want this strain, I want this many grams, and actually supporting the doctors who may not be as knowledgeable as those patients in backing them up when they say, you know, justify that amount to me, or why are you looking at that particular strain? What is it about that strain that you think is actually helping your symptoms? And starting to actually reintroduce the idea of medicalizing your use to an expert patient. Again, that conversation with a nurse and the nurse backing up the doctor is essential, because it's about negotiating that with the patient. A lot of my conversations when I was at Integro were surrounding, you know, okay, we'll give you this medication because you've requested it, but I would like you to try like an oil because you're currently requiring 90 grams of flour. And that indicates that actually you need long-acting symptom management, and the oils last for 6 hours and the flour only lasts for 2. So try it, and it will probably reduce the cost by 1/3 and actually mean that you can re-engage with your life. And actually, when you start to have an honest conversation with people as a clinician who had previously had lost all trust in the clinic, in the medical system, you're rebuilding trust with a missing patient group in practice. So that is some of the reasons why like nurses are essential. I hope that answers some of your question or part of your question.
No, I think most certainly does. I don't know, Elly, have you got things to throw in? I can see you nodding. I don't know if you've got anything else you wanted to,
Sophie's the one with the experience in cannabis clinics. I think just generally any specialist clinic, a doctor will come in, give loads of information to the patient, and the amount of times the doctor's left and the patient's turned around and looked at me and been like, right, I'll explain that all to you again, slowly, simply, and answer all the questions for you. So I think it's just having that support for the patient. And as Sophie says, with the complex patients, they know so much about their illness and what works for them, because it's all individualized for each person. But it's about getting them on the same page as you and understanding why you're suggesting X, Y, and Z. But like in any medical treatment, it's always the patient is at the center of it, and it's about fitting around, communicating with them and treating them with what works for them, their needs, and also their lifestyle.
Absolutely. I think, isn't it, do you find it interesting, I mean, I don't know if you find this, that perhaps cannabis patients are some of the best informed types of patients in terms of what they're looking for? I mean, you don't kind of go, well, I need, I want this particular type of, antidepressant, SSRI or something like that. Or you might, unless you've been on it for a long time, but, in terms of like self-diagnosis, cannabis patients know what they're looking for, but it might, like, as you were sort of saying, Sophie, that might not necessarily be the best course of action. So it's like, how do you kind of counter that when they're like, I've been doing this for years, I know exactly what I want, I know exactly the impact it has. What can you tell me now? Why do you know what I mean? Do you encounter that kind of thing quite a bit? And how do you kind of overcome it?
Yeah, absolutely. I mean, but it is like because expert patients is a term used for any patient who's very knowledgeable about their condition and lives it in their daily experience. So regardless of cannabis or no. Yep. So one of the many skills of a nurse is the ability to tailor your conversation to that individual. So if a patient comes and says, I want a strain that has this percentage of limonene, I want this myosin, I want this like terpene profile of a specific strain. So that, yes, the experience is definitely that patients did approach clinics knowing or felt like they had an exact medication in mind. But when you say, well, how do you overcome that? It's all about, it's about respectfully asking questions. Meet them as an expert. If someone says to you, I want this strain, ask them why. When do you medicate? What time? How much? Why does that particular terpene profile help you? Is there any particular terpenes within that profile that you find beneficial? Are there any that don't serve you, basically? Are there certain people who actually find limonene gives them headaches, but the rest of this particular strain profile actually does manage their aching, so like their muscle pain, or they manage their sleep? So, and it's all about having a real conversation at that level and encouraging them to think about what they do. Because if you think about prior to prescription, a regular cannabis patient or regular cannabis user as a patient was trying to find cannabis self-sourced, how much brain space that takes up and how much of your life that takes up, because actually you don't necessarily know that what the person who you're buying it off of is. They might say it's a particular strain and you might inhale it and it's something completely different, so that you don't have that guarantee of the same experience every time. Therefore, when you do find a strain that you find helpful, you are then trying to plan on how you might financially buy up all of that strain, because then in case it doesn't appear again for months and months and months, you are going into possibly, if you can't get from your normal dealer, then you're going to a different person, or you're texting all these people in your community trying to reach them. And it takes up so much of your time without thinking about it medically. It's just a logistically complex practice to try and maintain throughout your life, especially if you are in a position where you don't have good mobility or need someone else to help you drive you somewhere or walk or go and buy it for you. There's a whole range of logistics that need to happen, and not necessarily. So people have become very good organizers in that respect, but not necessarily thought about the medicalization of what they're doing. And now what the clinics should give the patient is should lift the weight off of them to say, these are the range of medications we would consider for you, your conditions, your symptoms. Tell me which of these might be appealing to you. Let's work together to find the best one. And I always said to people, it takes about 3 months of prescriptions to find the right combination, because it is a trial and error period at this time. Exactly as Elly said, it's very personalized at this stage, and there's no protocol for the like clinicians to follow, that we're so used to seeing beautiful flow diagrams of how to like step-by-step practices in our everyday like clinical work. So yeah, no, it's about respect and about meeting them at that level.
I can maybe say, without knowing about it, I imagine some expert patients in any field are in their own way a nightmare, because they won't get out of their own way, and it's very difficult to speak to someone who's managed something for so long and has come under that pressure to kind of let go of it. I imagine that is from time to time a challenge.
Dr. Google is the most qualified doctor in the country.
Absolutely, and the most easy to access and freest as well. Interestingly, I wonder why that might be.
That is true, but as the term nightmare feels, that idea is disrespectful. That to understand that the reason patients can be so aggressive in your session or so aggressive over the phone and say, no, I demand this, I want this, I know what's best for my body, is because they may not have had the experience of clinicians actually doing a good job of that. And they actually have found that if they don't fight for what they want or need in their general healthcare, they don't get it. So understanding that when a patient approaches you like that, it's probably because they feel like they've had to fight. Your job as a clinician, a good clinician who's got the gift of time, which is what private healthcare does, which is why cannabis in private healthcare is running the way it is. You know, in the NHS, it's a whole different story, right? But if you've got the gift of time, like actually give them the space to let them know that you heard them and that you're going to be on their team. Like that's a gift.
I'd be really interested to know, Elly, from like a research and like kind of study perspective, there's obviously more going on now than hopefully ever before, but how much from like, it's very difficult to do because it's qualitative data, but how much kind of does patient feedback and those expert patients, how much does that impact the things that are looked into? How much data collection is there involved at that kind of patient level to kind of grow a base of information around either effects or even just like the best way to care for someone, to have those conversations? Like,
there is a lot of data internationally, and there's a lot of companies trying to set up apps and AI technology into giving patients the best journey. But I think what we're really missing is MHRA approved, quality, reliable, valid data, large RCTs, large international studies across international multi-site studies, because what NICE guidelines, for example, will want is data under those guidelines. So it's, yes, you can do lots of qualitative questionnaires, and they are done, you know, I know there's lots being done in the USA, for example, but it's trying, what we really need are these large RCTs or approved MHRA regulatory approved studies, of which is very few. So that is, if we want to change guidelines, that is what we need. But studies like that cost millions of pounds. And it's how a lot of people don't realize how much it costs. And when I speak to a lot of companies, which I have done over the years, my first question now is, what is your budget? And I'm not going to, they can't get over how much research costs. And a lot of these companies don't or have or don't want to put the money into the research, and nothing will change unless it's definitely improving. But this is 12 years that I've been dealing with cannabis research, and only probably in the last year are things actually slowly starting to increase a little bit more.
Well, it's a tough one. It's a real tough one. And I think, you know, we spoke about it before. You know, we had a little brief call and kind of talking about the impact of rec markets and whether or not that impacts medical. And of course, from what you kind of said to us then, which was really interesting, is that it does, because it still needs the space to have investiture into research and into keeping it medical, you know, at least a section of it for the people that need it as medicine.
Yeah. I think one of the big problems in research as well is that you need certain documentations on the products to be able to submit it to MHRA and to get approval. And a lot of companies don't have the data on their products to be able to make what's called an IMPD document. And so a lot of, when I've said we need it to be able to submit, they're just not able to give it. And that just puts a stop immediately to be able to submit to MHRA without it.
it's a minefield, and it's so much of it, as you say, is based around budget, and there's companies that either don't want to invest or aren't able to at the moment, just based on the size of the market. There are so many factors, kind of macro factors, that kind of affect it beyond, you know, the great work that individuals are doing anywhere. What's your kind of guys' goal for this year? We're in January now, but like, what do you kind of want to get out of the year from Nurture Nursing? You know?
I'm going to go silent.
I know, so I thought I'd frozen, so sorry, you carry on.
It's for me, it's about building the awareness of nurses, educating nurses. I think and we have spoken with the RCN, getting them on board and having some input from them would be fabulous. It's very much, you know, this has been a while in the making, talking and setting everything up. And I'm very much, we both have jobs outside of this at the moment. I would love for this to become my full-time job, but it's about taking things slowly and really communicating with everybody out there to try and find, you know, not just what we feel people want and need, but understanding what it is out there that people want from nurses, how we can educate, building up our network. And you know, for me, I would love to be able to support some studies out there, you know, being able to educate nurses, getting them into clinics and building up a really good, strong, solid base of nurses with either experience or with a passionate interest in medical cannabis.
Absolutely. I was going to say, I mean, just to kind of think in terms of, okay, how do we collectively, I guess, in the UK promote the, you know, the benefits of medical cannabis? And it seems to be like there's a huge blocker in terms of adoption. And I know, do you think part of that is down to it being kind of private healthcare? People just
think the name would be good. That's my thing. I think we need to not be able to call it medical cannabis.
What should we call it instead then?
I'm no branding manager, but
no. It's an interesting question. It's like, you know, how do you kind of do that? You know, is it the same thing? There's the whole thing about doctors don't want to be prescribing, you know, strawberry kush or, you know, using those sort of names. But in the absence of there being, well, again, things do have certain names. Like obviously there's like pedianos, things like that, which is again different. But it's just that, you know, if we want to get more patients, you know, the access or get them to understand that, you know, this could benefit them therapeutically if they don't know about it. It's like, or they just kind of, they don't know anything about cannabis, you know, what efforts other than what's happening right now? What do you see as kind of almost like the stars aligning to create a good situation? What would be a good way forward, do you think? And again, I know that's a tricky question, but yeah, what can be done? Because again, if we've got, 89,000 patients or whatever it is, that's a hell of a lot more than 20,000. But then, you know, a few weeks ago that we thought it was 20,000. But, you know, so there's obviously some sort of miscommunications going on somewhere. But it's almost like to raise awareness. And I know that a lot of organizations are kind of looking into ways to do that, like the CICR and MCCS. And I think, you know, others. From your perspective, what else can be done?
I think there's like different at different levels, different things need to happen. So from a patient perspective, just if you have found it helpful for yourself and sharing that information with other people, that you're right. It used to be a big drawback was the cost, because we have, you know, the gift of the NHS, but because of the number of patients entering the space and getting prescriptions, that those costs are coming down. More and more access schemes are being implemented, so it makes it more financially accessible for more patients. So from a patient perspective, it's about communicating. From a sort of service provider clinic perspective, our answer is always to hire more nurses and invest in the infrastructure of your clinic so that you can provide good service for those patients and actually have patient retention. From that, you'll be able to produce, if companies could at least collaborate on producing true facts and figures about the number of prescriptions, like the safety profiles of cannabis medicines. There's some overarching numbers and figures that would be beneficial to every company in the industry. So if they were able to collaborate on that and they had good patient retention, then they would have good, accurate numbers for the number of prescriptions, number of patients who were with particular conditions, with particular medications. That would then mean that we could do much more targeted research. Companies who produce cannabis medicines would be able to not have more confidence in what they should produce and what they should invest in researching, because they already know that it's being prescribed a lot already. And from there, you'll be able to present that data to the outreach in wider clinical setting. So being able to produce clinical research to doctors, nurses out in NHS, and then those doctors and nurses would feel more confident to refer patients in. And eventually, that would mean that number of cannabis medicines would get to the NHS. I feel like that's what needs to happen.
That doesn't sound very difficult. Come on. I've taken it all down. We'll get started.
Yeah, note it down. You just check in next time. In a year's time, we'll come and do it again.
Absolutely.
I think a bit of health economics needs to be done as well. And I know that there is a project with Glass Farm and a couple of others that's being started looking at the cost effectiveness, because it's the one thing, especially any guidelines, if you can help save the NHS and everybody money, then their ears are going to prick up and they'll be interested. And it's one thing with the last NICE guidelines, when they did the review there was no input from health economics. And it's understanding that, if you prescribe the cannabis, then you're going to reduce X, Y, and Z and get a better quality of life sort of things. But looking, I don't like dealing with that side of it, because for me, it's more if it's beneficial for the patient, and obviously we need the data, but there's been very little done on the cost effective side of it.
Yeah, absolutely. I'm just trying to think. I had a thought, and now it's gone. I think
into the cloud. Pink fluffy.
I know. It's these clouds are just doing my head in.
There was something about pink fluffy clouds. I could start singing it.
Yeah, well, absolutely. No, I think. I mean, this. I think when you look across the pond at kind of the US and how they've kind of handled medical cannabis, and the kind of introduction of kind of recreational cannabis in certain states. I mean, what always strikes me that if you can one exist alongside the other kind of mutually, and that's for me again. What we're going to be speaking to, you spoke about Catherine at Leaf, 411 in a couple of weeks, and again, but it's just like, how do they coexist? How can you treat one if you've got a kind of recreational market, and how do you kind of then still create that kind of not police, that's the wrong word, but how do you kind of present the medical market in that respect, and can you treat them separately? It's very
hard.
Yeah,
very hard. And I know that speaking with Eloise and Catherine over in the US, it ruined a lot of companies and understanding and having the recreational side of it. I don't think but we do it with other medications. So it's how, you can use it recreationally, and it's gone into that. I can't work out how to explain it, but having that recreational side that they have in Canada and the US, it's very different, very difficult. I can't remember the story Eloise was telling us, Sophie, about what it did to some numbers and the need of people. But I think with the way the laws are in the USA, and as you say, you're speaking with Catherine in a few weeks, because it's not federally legal at the moment. I think if it was to become federally legal rather than state by state, it will be a whole different ball game over there.
Yeah. No, it's
yeah. There's like Jamie touched on earlier, was this what has been fed back to us from the States is that when a recreational market has been made available, then the companies who produce cannabis medicines or want to get involved in cannabis no longer see the requirement to spend the billions of dollars on clinical research to figure out how cannabis medicines work, or how cannabis medicines work for particular conditions, because they can make money a lot faster by selling it recreationally and selling the product at a good standard recreationally. So in that respect, if you're trying to run them alongside each other, that the medical community miss out on finding out valuable information that could potentially impact millions of people, and how we approach different conditions that are very complex, like fibromyalgia springs to mind. But I also think that if there was some level of collaboration between recreational and medical, in the sense that if there was a way of screening recreational users to identify how and why they were using it, that actually there could be hundreds of thousands of patients in that rec market in the States that would actually be patients or classified as patients. So actually that your recreational users or your recreational service almost acts like a referral service for medical patients once they're identified, and they get clinical support, and it's a very different thing. But it's also about how much people want clinical interaction, I think, especially with somewhere like the States where you have different options and different models. But for me, it's about trying to get these organizations to collaborate in some way, that's for me one of the key issues in medical cannabis as an industry or as a field internationally, is that it's an industry that has been born out of activism, and now that it's been made legal in a variety of ways, it's become a place where industries are looking to build industry rather than progress a field. And I think that's what a lot of patients who have advocated are upset about. And I think there's a real distrust in the industry that's trying to come in to this space. But actually, you need the industry to provide the money and the revenue to provide the evidence that's needed for to move the whole field forward in an advocacy way. So it's about collaboration is the key.
100%. No, I think there's some really, really interesting points then. But no, thank you both very much for coming on. And let's catch up in a year or less and have the conversation. What's happening now? Has the things changed?
I'll see how many of the things Jamie's ticked off the list.
Absolutely.
I'll be done by the week. Don't worry. Friday.
Yeah.
Absolutely. The path to, medical cannabis. Absolutely cool. But thank you both very much. And, wish you all the best of luck with Nurture Nursing. And where can people find out more information about what you're doing?
So we have a website, www.nurturenursing.com, where our services are sort of laid out, and a little bit more about us. And we are on LinkedIn, Facebook, Twitter, and Instagram. So find us wherever is sort of convenient for yourself.
Absolutely brilliant stuff. Okay, cool. Well, thank you, and best of luck and goodbye. We'll speak to you soon.
Thank you very much.
Cheers.
Thanks, guys.